Welcome to my channel. In this video of health and healthy habits, we're going to learn about asthma. Asthma causes the airways, or the tubes that carry air in and out of the lungs, to become inflamed, narrow, and produce extra mucus. This can make breathing difficult and trigger symptoms such as coughing, wheezing, shortness of breath, and chest tightness. These symptoms can vary from person to person and can be mild or severe. Some people may have symptoms only at certain times, such as when exercising or exposed to allergens, while others may have symptoms all the time. Asthma symptoms can also get worse suddenly, which is called an asthma attack. Asthma attacks can be life-threatening and require emergency treatment. The exact causes of asthma are not known, but it is likely due to a combination of genetic and environmental factors. Some factors that can increase the risk of developing asthma or trigger asthma symptoms include family history of asthma or allergies, exposure to allergens such as dust mites, animal dander, pollen, mold, or cockroach waste, exposure to irritants such as tobacco smoke, air pollution, chemical fumes, or strong odors, respiratory infections such as colds or flu, physical activity or exercise, cold or dry air, emotional stress or anxiety, certain medications such as aspirin, beta blockers, or nonsteroidal anti-inflammatory drugs, NSAIDs, gastroesophageal reflux disease, DERT, a condition that causes stomach acid to flow back into the esophagus, food additives or preservatives such as sulfites. Asthma cannot be cured, but it can be controlled with proper diagnosis and treatment. The diagnosis of asthma is based on a careful medical history, a physical examination, and some tests to measure lung function and identify possible triggers. The tests may include peak flow meter, a device that measures how fast you can blow air out of your lungs. A low peak flow rate indicates that your airways are narrowed. Spirometry, a test that measures how much air you can inhale and exhale, and how fast you can exhale. Spirometry can show if your airways are obstructed or inflamed. Allergy blood test, a test that detects antibodies in your blood that are produced in response to specific allergens. This can help identify what substances you are allergic to. Methacholine challenge test, a test that involves inhaling a substance called methacholine, which causes the airways to tighten in people with asthma. This test is done when spirometry results are normal, but asthma is still suspected. Sputum eosinophils, a test that examines a sample of your sputum, mucus, and saliva under a microscope to look for eosinophils, a type of white blood cell that is involved in inflammation. A high number of eosinophils indicates that your airways are inflamed. The treatment of asthma aims to reduce inflammation and prevent symptoms from occurring or worsening. The treatment usually involves taking medications that are either inhaled or taken by mouth. The medications may include short-acting beta-2 agonists. These are inhalers that provide quick relief of symptoms by relaxing the muscles around the airways. Examples are albuterol and terbutaline. Long-acting beta-2 agonists. These are inhalers that help prevent symptoms by keeping the airways open for longer periods of time. Examples are formoterol and salmeterol. These should not be used alone, but in combination with inhaled steroids. Inhaled steroids. These are inhalers that reduce inflammation and swelling in the airways. Examples are fluticasone and budesonide. Leukotriene modifiers. These are pills that block the action of leukotrienes, chemicals that cause inflammation and constriction in the airways. Examples are zafirlukast and xoluton. Xanthines. These are pills that help open the airways by relaxing the smooth muscles around them. An example is theophylline. Steroid tablets. These are pills that reduce inflammation throughout the body. They are usually used for severe or uncontrolled asthma. An example is prednisone. Biologics. These are injections or infusions that target specific molecules involved in inflammation and allergic reactions that are usually used for severe or uncontrolled asthma that does not respond to other treatments. Examples are rosalizumab, mepolizumab, and benralizumab. In addition to medications, some people with asthma may benefit from a procedure called bronchial thermoplasty. This involves applying heat to the airways using a thin tube inserted through the nose or mouth. The heat reduces the amount of smooth muscle around the airways, which helps prevent them from narrowing. This procedure is usually done for people with severe asthma who do not improve with medications. People with asthma can also manage their condition by avoiding or reducing exposure to the triggers that cause or worsen their symptoms. Some of the ways to do this are keeping the home clean and dust-free, using air filters or humidifiers to improve indoor air quality, avoiding smoking and secondhand smoke, wearing a mask or scarf when outdoors in cold or polluted air, getting vaccinated against influenza and pneumonia, following a healthy diet and staying hydrated, practicing breathing exercises or relaxation techniques, having an asthma action plan that outlines what to do in case of an attack. Hey there, amazing viewers! If you're enjoying the content so far, don't forget to hit that subscribe button and ring the notification bell so you never miss an update. Sharing is caring, so if you found this video helpful, informative, or entertaining, consider sharing it with your friends, family, and anyone who might benefit from it. Your support goes a long way in helping us create more valuable content. Thanks for being a part of our community.